Health Promotion, Part 1. The exemplars in this particular topic are going to be adult development, cultural influence, health teaching, levels of prevention, reduction of risk potential, self-care, and sleep hygiene. Interrelated concepts include acid-base imbalance, caring, comfort, cognition, digestion, elimination, fluid and electrolyte imbalance, gas exchange, immunity, leadership, metabolism, mobility, mood and affect, perfusion, perioperative, professionalism, reproduction, sensory perception, stress and coping, and tissue integrity. Health promotion is the process of enabling people to increase control over and to improve their health. It requires the adoption of healthy living practices and often necessitates a change in behavior. Long-term success of health promotion efforts is largely dependent on adaptation to change. Attributes of health promotion include optimization of health, evidence, client and community centeredness, and enculturation. Disease prevention, which is also referred to as health protection, is considered a component of health promotion and refers to behaviors that are motivated by a desire to avoid illness, detect illness early, and manage illnesses when they do occur. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. The health of the public is measured globally by morbidity, how frequently a disease occurs, and mortality, which is the number of deaths that result from a disease. Each person will define health in terms of their own values and beliefs. Family, culture, community, and society also influence our perception of health. A similar term to health is wellness, but unlike health, there is no universally accepted definition. Wellness can be defined as an active state of being healthy by living a lifestyle that promotes good physical, mental, and emotional health. It also refers to a positive state of health in an individual, family, or community. It's multidimensional, encompassing several dimensions that include physical, mental, spiritual, social, occupational, environmental, intellectual, and financial. And wellness is seen as a continually changing state that ranges from high level to low level wellness. Disease is a functional or structural disturbance that results when a person's adaptive mechanisms to counteract stimuli and stresses fail. Disease is a medical term that refers to a pathologic change in the structure or function of the body or mind. Although similar to disease, illness is seen as the physical manifestations and the subjective experience of the individual. It can be present in the absence of disease, and it's possible to have no illness when a disease is present. Likewise, many individuals can experience wellness in the presence of an illness. For example, a person that has type 2 diabetes, which is a chronic illness, can experience high-level wellness. Low-level wellness would be seen as an unfavorable state in which illness can result. And then we have acute illness, which generally has a rapid onset of symptoms and lasts only a relatively short time. Examples would be appendicitis, pneumonia, diarrhea, or the common cold. Chronic illness, however, has a slow onset, sometimes with periods of remission and exacerbation. There may be a permanent change, or it can be caused by irreversible alterations in the normal state. It does require a long period of support. Question: which is an example of an acute illness? Diabetes, rheumatoid arthritis, pneumonia, or osteoporosis? This is pneumonia. The nurse's role in health and illness can vary. It is very important that the nurse is involved in self-care. The nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. The American Nurses Association defines a healthy nurse as one that actively focuses on creating and maintaining a balance of and synergy of physical, intellectual, emotional, social, spiritual, personal, and professional well-being. Self-care is defined as the ability to care for oneself through awareness, self-control, and self-reliance in order to achieve, maintain, or promote optimal health and well-being. Symptoms of not practicing self-care include compassion fatigue, burnout, and secondary traumatic stress. Resilience is an individual's aptitude for overcoming an adverse life circumstance with a hopeful attitude. It utilizes healthy internal coping mechanisms and utilizes external resources such as supportive work environments, mindfulness-based stress reduction training, and assertive communication skills training. Self-care can include getting enough sleep, eating an appropriate healthy diet, varying the work that you do, doing at least light exercise, doing something pleasurable, in other words, doing something for yourself, focusing on what you did do well, learning from your mistakes, and owning your mistakes, in other words, being accountable for your mistakes. Sharing of a private joke, praying, meditation, and or relaxation, and potentially supporting a colleague when he or she makes a mistake. There's a couple of self-care models. The ENERGY acronym is a self-care model that can help clinicians reduce stress and promote well-being. It stands for energy source, nurturing kindness, emotional hygiene, refocusing purpose, germinating positivity, and your uniqueness. Another model is the acronym STOP. This is a mindfulness technique that can help people manage overwhelming emotions and distress. Stop and pause, take a few breaths, observe your current state without judgment, and proceed with awareness. With client care, self-care includes the assessment, planning, and implementation of interventions and the evaluation of health promotion strategies for individuals. Per the Healthy People of 2020, health promotion has been shown to add quality years of life and to decrease healthcare costs. Goals of Healthy People 2020 include attaining high-quality, longer lives that are free of preventable disease, disability, injury, and premature deaths. Achieving high health equity, eliminating disparities, and improving the health of all groups. Creating social and physical environments that promote good health for everyone. And promoting quality of life, health development, and health behaviors across all life stages. Leading issues with the Healthy People 2020 include access to health services, environmental equality, injury and violence, maternal, infant, and child health, mental health, nutrition, physical activity and obesity, oral health, reproductive and sexual health, and substance abuse and tobacco. Examples of how health promotion is used in nursing include providing strategies to maintain that healthy lifestyle, recommending immunizations across the lifespan, and providing strategies for each level of promotion. Values and beliefs about health, illness, and healthcare will be influenced by cultural, ethical, or religious groups. These beliefs may encompass how we feel about traditional or folk healers or about other treatment options. And as a client readies for discharge, we need to practice reviewing, reflecting, regrouping, and re-energizing. What are risk factors? A risk factor is defined as a variable or characteristic that increases the likelihood of developing a disease or infection. Common health risks are basically any situation, habit, or other variable such as social, environmental, physiological, intellectual, or spiritual that increases vulnerability of an individual or group to an illness or accident. Lifestyle risk factors include a lack of knowledge about sexual and marital roles, leading to teenage marriage and pregnancy, divorce, sexually transmitted infections, child, spouse, or elder abuse, and lack of prenatal or child care. It also includes alterations in nutrition, either more or less than body requirements at any age. Chemical dependency, including the use of alcohol, drugs, and nicotine. Inadequate dental care and hygiene, and unsafe or unstimulating home environments. Psychosocial risk factors include inadequate childcare resources, like when both parents work for preschool and school-age children. Inadequate income to provide safe housing, food, clothing, and health care, and conflict between family members. Environmental risk factors include a lack of knowledge or finances to provide safe and clean living conditions, work or social pressures that cause stress, and air, water, or food pollution. Developmental risk factors include families that have new babies, especially if support systems are unavailable. Older adults, especially those that live alone or on a fixed income. Unmarried adolescent parents who lack personal, economic, and educational resources. Biologic risks include birth defects, intellectual disability, genetic predisposition to certain diseases, including cardiovascular diseases and cancer. Risk modification is aimed at cessation of harmful or unbeneficial behaviors, adoptions of healthy behaviors, and we need to understand that it's difficult to change negative health behaviors, especially if they have been ingrained into a client's lifestyle. True or false? An example of a developmental risk factor is a family that has inadequate childcare for a preschool child when both parents are working. This is false. That's a psychosocial risk factor. There's three main levels of prevention. We have primary prevention that refers to evidence-based strategies that are aimed at optimizing health. The focus is on education for optimal nutrition, exercise, immunizations, safe living and working environments, hygiene and sanitation, protection from environmental hazards, avoidance of harmful substances, protection from accidents, and effective stress management. Examples of primary prevention include immunization clinics, family planning services, poison control information, and accident prevention education. Secondary prevention is the goal of secondary prevention is to identify an individual in an early state of a disease process so that prompt treatment can be initiated. The focus here is going to be on screening tests. Screening is recommended as early treatment will provide an opportunity to cure, limit disability, or delay consequences of an advanced disease. Examples would be assessing children for normal growth and development, and encouraging regular medical, dental, and visual examinations. And then we have tertiary prevention. This involves minimizing the effects of disease and disability. The focus here is going to be on restoration through collaborative disease management so individuals can achieve the highest level of health. This will optimize the management of a condition and minimize complications so that the individual can achieve the highest level of health that's possible. Examples would include teaching a client with diabetes how to recognize and prevent complications, using physical therapy to prevent contractures in a client that's had a stroke or a spinal cord injury, and referring a woman to a support group after removal of a breast because of cancer. What is an example of a nursing activity that promotes secondary prevention as a level of preventive care? Is it conducting a smoking cessation class? Performing a blood pressure screening at a local mall? Performing range of motion exercises on a bedridden client? Promoting safer sex practices in all settings? This is B, performing that blood pressure screening at a local mall. The health belief model is a framework that helps explain why people choose to participate in certain health behaviors. This model is based on the idea that people's beliefs about health and health conditions play a role in determining their health-related behaviors. And there's 5 components. Perceived susceptibility, how likely someone is to get a particular health condition. Perceived severity, how serious the health condition is and its consequences. Perceived benefits, how effective taking action is to reduce the risk or seriousness of the health condition. Perceived barriers, or the obstacles or costs associated with taking action. And self-efficacy, which is the level of a person's confidence in their ability to successfully perform a behavior. The health belief model suggests that people are more likely to take preventive action against a health risk if the perceived benefits outweigh the perceived barriers. The health belief model also suggests that a stimulus or cue to action has to be present to trigger health promoting behaviors. This is often based on internal factors, which include the developmental stage, intellectual background, perception of functioning, emotional factors, and spiritual factors. And those external factors, which involve family practices, psychosocial and socioeconomic factors, and cultural background. And health teaching. Excuse me. Client education is the process of assisting people to learn health related behaviors that they can incorporate into everyday life with the goal of achieving optimal health and independence in self care. Teaching should be ongoing and interactive. We also need to consider the learning domains, which include cognitive, that requires thinking and encompasses acquisition of knowledge and intellectual skills. Affective, which deals with the expression of feelings and development of values, attitudes, and beliefs. And psychomotor, which involves acquiring motor skills that require coordination and integration of mental and physical movements. Goals of teaching include maintaining and promoting health. We need to help families or communities achieve the optimal levels of health. And an essential component of these goals, is to provide safe, client-centered care while reducing healthcare costs and hardships on individuals and people surrounding them. Preventing illness is another goal. Restoring health, facilitating coping, and promoting positive outcomes round out the goals. Topics about health promotion include developmental and maturational issues, normal childbearing, hygiene, nutrition, exercise, mental health, and spiritual health. Illness prevention would include first aid, safety, immunizations, screenings, and identification and management of risk factors. Health restoration involves orientation to treatment center and staff, the clients and the nurses' expectations of each other, the illness and physical condition, anatomy and physiology, the etiology of the problem, the significance of the symptoms, and the prognosis. The nursing care and healthcare regimens and how the client can participate in care. And self-care practices the client and family or caregivers need to be able to manage the client's condition independently. With coping facilitation, we need to know how the client's physical and mental condition affects other areas of functioning and lifestyle counseling. Measures that maximize independence and enhance self-concept, stress management, environmental alterations, community resources, appropriate referrals to maybe physical therapy or occupational therapy, etc., along with grief and bereavement counseling. Now, steps of the teaching learning process include assessing the learning needs and the learning readiness of the client. We need to determine if the client is ready for teaching by assessing their physical discomfort, determining if they have an elevated anxiety. Are there any environmental distractions? Is the client motivated and or have a desire to learn? Is the client able to learn? And understanding that adults want teaching to be relevant and they're going to use past experiences when they learn new information. It's also important to identify the client's learning needs, develop learning outcomes, develop a teaching plan, implement that teaching plan and strategies, and then always evaluate learning. We can teach through a variety of methods that include discussion, lecture, question and answer, role playing and discovery, especially with the younger client, independent projects, demonstration with return demonstration, which is one of the best ways to learn skills, such as dressing changes or how to administer an injection, practice, and games. And we should always follow up our teaching by providing written material for later reference.